Dr. Jaffe, how do you feel about using vitamin D3 in larger doses, say up to 60,000 IU daily, to support immune function and response for short periods of time? Does that work?
That is one of the most important questions, and I'm going to offer my answer, then I will offer other people's answers because it depends how you look at the situation. I increasingly am an advocate for physiology before pharmacology. When we talk about 50,000 or 60,000 IU once a week or once a month or on some schedule, that can be done, that has been done. Benefits were observed. But it's a form of pharmacology that I technically conclude is less helpful than taking vitamin D with a little K2, but vitamin D drops under the tongue before swallowing to keep you in the 50 to 80 range. When you take those high doses periodically, what is your average vitamin D level? And when would you measure it? And most of the studies, frankly, have been done with ergosterol. That's a synthetic form of vitamin D. It's called D2. It can be measured separately from D3. I personally recommend physiology before pharmacology. I recommend nature's forms, and in this case, nature's form is cholecalciferol, D3. Dr. Michael Hollick, who is known as Dr. Sunshine, he is a world-renowned vitamin D expert, both on the analytic side and on the clinical side. And he has actually done most of the trials with the high-dose episodic vitamin D. Then you have other people who say, on average, it's probably too low. Periodically, it gets very high, like right after the injection. But I really want to know what the average daily vitamin D3 level is. And then just to get a little complicated and then to clarify, you can measure 3 different forms of vitamin D. I don't think you need to. I think most of the time you measure the 25 hydroxy vitamin D level. And that tells you plenty of what you need to know about vitamin D. There are occasions when you need to measure all 3 levels, and then I would recommend that you work with a vitamin D expert who can help you sort that out. But that won't come up very often. The one other thing that I think is worth saying is, what is your philosophy of care? If your philosophy of care is a double-blind, placebo-controlled trial, you might conclude that D2 and D3 are not quite interchangeable, but mostly interchangeable. I look at the same literature and I don't reach that conclusion. So I have felt and been rewarded over decades for advocating, follow Mother Nature. Follow the natural form. And we do know today that many people, millions of people, have enough digestive impairment, enough enteropathy of their digestive tract that they don't absorb vitamin D, if at all, from the gut. But they will absorb it under the tongue if they put the drops under the tongue before swallowing. So we know what the target range is. It's 50 to 80. That's the goal range. If you're a little bit above or a little bit below that, it's okay. But I don't see the need or actually the value of the high dose periodic therapy.